Arthritis can potentially affect many of us in our lifetime, becoming more painful for some. The Arthritis Relief Centers has a non-surgical treatment option, and here to tell us more about it is CEO Kevin Barton. Kevin, who is a good candidate for this service or the services you guys offer at your centers?
Yeah, thank you for having me on the show today. So knee arthritis affects, there's over 500 million people worldwide affected with knee arthritis right now. It's a problem that's been 100% more prevalent in the last 20 years. So it's a problem, unfortunately, that's not going away. Patients that typically suffer from knee arthritis have stiffness in the joint, especially waking up in the morning. They can have swelling in the joint, pain with getting in and out of their car, things that, you know, a lot of us take for granted.
Absolutely, and that just sounds debilitating in a way when it comes to a certain level of pain, right?
It certainly can be, and we know that knee arthritis is the #1 leader of disability in patients over the age of 55.
And that's still pretty young, so you know,
is young.
You want to have a good life. You have something that could potentially help. Tell me about this non-surgical treatment. It's like a gel injection,
correct? Yeah, absolutely. So these treatments have been FDA approved for over 30 years. We've been doing these treatments in the San Antonio area for almost 15 years. We've done hundreds of thousands of these injections for patients, and patients do quite well with them. So our goal is to help prevent patients from having knee replacement surgery. So the gel basically is like a thick cushioning and lubricating gel that mimics our natural fluid in the joint. When patients develop arthritis, arthritis is this wear and tear type of disease that happens over time. There's lots of factors that contribute to arthritis, including age, obesity, lack of exercise. Sometimes injuries lead to arthritis. And so when we develop arthritis, the cartilage on the end of the bones is starting to wear down. When that cartilage wears down, we start to lose the ability to create that natural cushioning and lubricating fluid. So really all we're doing is kind of giving the knee an oil change.
And giving that fluid they may not have anymore. So how often does a patient need to get those injections?
So these injections typically are done in a series. We do anywhere from 3 to 5 injections 1 week apart. And then if patients do really well with these treatments, we can repeat them in 6-month intervals. Because it's an all natural fluid, the body's gonna slowly absorb the gel over time.
And if someone might be, I guess for lack of a better word, skeptical, or they haven't seen the results in a similar product in the past, what would you say to them about this?
Yeah, so like I said, these treatments have been FDA approved for over 30 years. Literally like 70 to 80 million of these procedures have been done worldwide now over the last 30 years. So this is a very tried and true treatment. At the end of the day, we want surgery to be a last resort. So this is a fantastic conservative treatment option we can give to our patients that's safe, it's FDA approved, it's effective, and there's really almost no downside to the treatment.
Well, that sounds like something that could be very helpful for our audience, especially hearing that number 500 million is a lot of people.
It is a lot of people, yes.
So you have a couple locations. You have in San Antonio and New Braunfels, correct?
We do, absolutely. So in San Antonio, we're off the North Loop 1604 between Northwest Military and Bidders. And in New Braunfels, we're near the Baptist Resolute Hospital.
Okay, well, thank you, Kevin, so much for being with us this morning. If you guys are listening, you're like, I need to get in touch with them. Well, here he is, and make sure you guys give him a call. Stay with us.